Then let's go to this now. Minister of Health, Dr. Nqobile, is expected to give an update on South Africa's strides in fighting TB. In 2023, the World Health Organization reported that the bacteria surpassed COVID as the most infectious disease. Now millions of people are at risk after the United States halted funding. Newzroom Afrika's Nqobile Madlala now joins us live from Sandton. Nqobile, once again, a very good morning to you. Tell us about some of the concerns that have been raised by the various stakeholders considering the cutting of the fund.
Well, Aldrin, you'll know that the World Health Organization also said that the goal is to end TB by 2035. That is the goal, and of course, with more funding, that sort of enables it to ensure that things can be done correctly. However, in this case, you have quite a lot of people that are going to be engaging here to see what is the way forward now. And I want to bring in now the civil societies to speak to us to those issues. And I mean, we know that the US aid being halted is going to affect how we fight the TB and, of course, HIV in the country.
No, certainly. I think firstly we're very grateful to the American people who invested in the AIDS response since 2003. And without that investments, we wouldn't have been able to achieve the successes that we've had as a country. In terms of HIV, we're very close. You know, 95% of people who are living with HIV know their status. Of that, at least 78% are on treatment. Right? And I think the big push now is to move that 78 to 95, because all people on treatment are virally suppressed, which means they can no longer transmit. TB, similarly, you know, we've done well. We've achieved the 2020 targets of the NTB strategy. We had some interruptions with COVID, but through civil society's prompting, we started working on a TB recovery plan that was informed by civil society and driven by things like the National TB Think Tank. And now 4 years later, I think we've made significant gains. But, you know, we can't continue in the way that we do. You know, the US funding at a service delivery level, we're fairly confident that the country can absorb that. But there's also other aspects of it that we probably will need to engage. And a lot of that is around the science. But yes, we are grateful to the American people. The loss of the funding will have a significant impact. But as South Africans, we'll make a plan and we were able to move forward.
And what is the role of then civil societies during this time?
Look, South Africa's got a very unique system. We don't hand over power at elections. Our Health Act is set up, and a lot of the acts in government is for participatory governance. So civil society is involved at all levels of the health system in the design, evaluation, and implementation of health policies. So in this, you know, through SANAC, it's a multi-sectoral body that includes over 17 sectors as well as multi-sectoral government departments, and it's chaired by the Deputy President, so it's like the highest level of political commitment. And we've given life to that during COVID. Like I said, civil society was instrumental in the development of the TB recovery plan. Since then, we've been working hand in hand in understanding what role civil society can play in strengthening the response to TB, particularly because we're proximate to the communities, you know, that are affected by TB. And through SANAC and other structures like that, we're also proximate to power. So we are able to bring those two sectors together to make sure that we have person-centered responses. And it's in the results. You know, we went from 100,000 missing patients a couple of years ago, and we've reduced that amount to 66,000. And I think what we want to do now is, through implementing this NTB campaign, which is about testing 5 million people a year, is significantly reduce the 66,000 people who acquire TB in a given year but don't access treatment, and in that way reduce deaths.
And of course we understand that there's a stigma that is aligned with what is taking place on the ground. People don't quite understand or have enough knowledge with regards to TB, assuming that you must be very sick or you have to have certain signs to say that you have TB.
No, certainly. I think the best way to counter stigma is more information and universality. Right, and I think one of the things that we are pushing very hard on is by strengthening universal health coverage or district health services and making sure that people can access a TB test anyway, we reduce the stigma. We must understand that one of the first things that we confronted as a country, right, in the early 90s was the emergence of the HIV pandemic. And TB stigma is a lot associated with HIV stigma, right, from those early days, but we're in a very different place now. So I think one of the best ways that we can deal with stigma is to bring everything into the light. universalize access to TB testing wherever. And I think the goal with doing 5 million tests in high burden TB areas, we can normalize TB testing. And by normalizing TB testing like a routine thing, like you check your blood pressure, we can begin to start ending TB as a public health threat.
All right, thank you very much for speaking to us. And of course, those are some of the conversations that are going to be taking place here, Aldrin, as you can hear there for civil societies, is to ensure that you end that stigma that is faced by many people that have tested positive for HIV and AIDS or for TB.